For most people, mistletoe brings to mind nothing other than Christmas. But besides serving as a festive holiday decoration, did you know that mistletoe is used in herbal medicine and it's been used for hundreds of years? It's a little known fact that there's actually more than one type of mistletoe. In fact, it's believed there's over 100 different kinds of mistletoe species that grow around the world. A few of these are commonly harvested for their medicinal properties. American mistletoe is the type that grows in the US, and it's used as a romantic holiday decoration, while European mistletoe, Viscum album, is the species that's been used for centuries in traditional herbal medicine. A third species of mistletoe is less common, but it's used by some to treat high blood pressure and gastrointestinal complaints. Other species include Japanese mistletoe, which is known for its many antimicrobial and antioxidant properties. According to the National Centre for Complementary and Integrative Health, some of the many ailments that mistletoe can help to treat include seizures, headaches, arthritis symptoms, and potentially even treat cancer. While it may have been considered a top herb for healing throughout history, and currently in Europe, there's not much evidence showing that it definitely works. Mistletoe burrows its roots into wood of trees and it feeds on their sap. A heavy infestation with mistletoe can kill branches of the host plant and even the entire host. This is one reason why mistletoe has earned a reputation as being poisonous. Once dried and made into an extract, it is typically given as an injection. It can, however, also be taken by mouth as a capsule and a supplement and consumed as a tea or tincture. Studies have identified different kinds of free radical scavenging antioxidants, antimicrobial and anti-inflammatory constituents with various species, including flavonoids, alkaloids, lectins, polypeptides, arginine, polysaccharides, tannins, terpenoids, steroids, acidic compounds, glycosides, and gallic acid. It's well known that parts of the plant, including the berries and the leaves, can cause serious side effects when they're consumed orally. Poisoning can also occur if you drink a tea that's created from the plant, or its leaves or berries. The poisonous active ingredient in the mistletoe is called phototoxin. Symptoms are most likely to occur after ingesting the leaves, and they usually last from 1 to 3 days. Other potential adverse reactions include vomiting, diarrhea, cramping, and liver damage if it's used in the long term. All of that being said, the mistletoe, when used as a medicine, seems to be generally safe. According to a 2018 statement published in PDQ, Integrative, Alternative and Complementary Therapies, editorial board, few side effects have been reported from the proper use of mistletoe extract. Mistletoe has been used for centuries in traditional medicine and medicinally in Europe since the 20s, but limited research exists on its effects. Most of the clinical trials focusing on mistletoe that are available have been conducted in Europe. Some trials have found evidence that the mistletoe can help to improve survival and quality of life in cancer patients. Currently in the US, mistletoe is only used in clinical trials and not otherwise indicated for use. Extracts are given by injection in Europe, where the mistletoe is currently sold as a prescription drug, most often for cancer. Today, the mistletoe extracts are the most frequently prescribed unconventional cancer therapy in Germany and some other European countries. In certain studies, it's been shown to stimulate the immune system and to kill certain cancer cells. However, these effects have mostly been observed in test tubes and not in humans. A number of in vitro studies have reported immunostimulatory, cytotoxic, and pro-apoptotic effects. Some have shown that the mistletoe extract demonstrates the ability to block the formation of new vessels, cutting off the blood supply to tumours. There's some research that suggests the administration of European mistletoe extract might offer help in the treatment of breast cancer, advanced pancreatic cancer, colon cancer, bladder cancer, especially in those with recurring bladder cancer, stomach cancer, liver cancer, leukemia, lung cancer, ovarian cancer, and uterine cancer. Another potential use is reducing the side effects of cancer treatments, including chemotherapy and radiation therapy, and improving the quality of life during the recovery. A 2016 systematic review published in the Journal of Complementary and Alternative Medicine found that mistletoe therapy trials in cancer show promising results in improving the patient's quality of life during the chemotherapy and the reduction of the fatigue. The review found that overall patients reported demonstrable changes to their physical, emotional, and psychological well-being following the mistletoe, as well as a reduction in the chemotherapy side effects. There's some evidence that mistletoe has traditionally been used for hypertension and gastrointestinal complaint management. This may lower the risk of blood vessel conditions, including high blood pressure and atherosclerosis, the thickening and the hardening of the arteries. A 2011 study published in Biochemistry Research International that was conducted on rats found that it had anti-hypertensive and anti-arthrogenic and vasorelaxation effects that could potentially reduce the cardiac episode. Mistletoe can be used for bathing. You can also apply it to the skin to help to treat varicose veins, ulcers on the lower legs, and eczema. Some also believe that it has pain-killing properties and can be used to help to treat joint pain, rheumatic and neuralgic pains when it's rubbed into the skin. Mistletoe has emerged as a promising alternative therapy against mood-related conditions, including depression, anxiety, and fatigue, especially when these conditions are associated with cancer treatments. Several studies have shown that mistletoe can improve the coping ability of both cancer patients and survivors. Mistletoe has been used to help to manage the menopause symptoms such as fatigue and trouble sleeping, and to regulate hormones when a woman experiences irregular periods. In postmenopausal women, the population most likely to suffer from osteoporosis, it may also be able to help to defend against weak bones and fractures. Although not many studies have directly observed mistletoe's effects on the respiratory system, various mistletoe plants are claimed to exert antioxidant, analgesic, anti-inflammatory, and immune stimulatory properties, making them defenders against illnesses and infections. Supplementing with mistletoe may be able to help to fight off common colds, sore throats, fevers, coughs, and respiratory issues like asthma. Although this hasn't been proven in studies, to defend against respiratory issues and colds, it could be consumed as a tea or a tincture or inhaled. The name mistletoe is believed to have been derived from the Celtic word for all heal. Records tell us there were many historical uses of mistletoe, most of which focused on healing the nervous system. Mistletoe was used to treat conditions including nervousness and anxiety, sometimes in combination with valerian root. Convulsions, hysteria, neuralgia, skin problems, urinary disorders, fever, and heart disease. In some traditional medicine systems, mistletoe was believed to be a natural heart tonic that could strengthen the force of the heartbeat and increase the heart rate. Herbal formulas that include mistletoe, valerian, and vervain were often given for all kinds of nervous complaints caused by hormonal imbalances and fatigue, etc. In traditional medicine systems, mistletoe was usually made into a healing tea or a tincture. Another traditional use of the mistletoe berry was to use them to make salves for skin problems like sores or ulcers. Use the smallest possible dose that can exert an obvious effect. Some herbalists use only 1 to 2 milliliters of extract per day in divided doses. Low doses of 1 milliliter per day are even used by some doctors as a complementary cancer treatment. Crude mistletoe fruit or herb used to make tea, typically to treat hypertension, is recommended at a dose of 10 grams per day. Extracts are usually given by intravenous or subcutaneous injection at doses of 0.1 to 30 milligrams several times per week. For more information about herbs, health supplements, or conditions, check out my website.